the three, main, injuries associated with these past wars, the war in Iraq and Afghanistan, were post-traumatic stress disorder, traumatic brain injury, and chronic pain, if you can consider that a disease. So these are the signature injuries of warfare. And so if you look at the reasons so we had so people know that I do, pain research, but one of the things that that we've done that people are not, aware of is we did a lot of, big articles on the reasons that people get evacuated from theater, because it's very important. So we did an article in 2010. It was translated into like 30 languages, like in Chinese, and it was really the main article of a special edition of the Lancet, and we looked at every single person who was evacuated from theater between 2004 and 2007 for any reason, and we categorized them, and it changed. So early on in 2004, combat injuries were big, and then they started to decrease. Psych injuries started to increase with multiple deployments. But number one, by far, every single year, wasn't even close, were musculoskeletal injuries. And neurological injuries, which could include things like headache, and then spine injuries were in the top 5. So that's something that concerned me. And if you looked at the percentage of people who were evacuated from theater, what percentage returned to theater, so that's what all the military cares about. The military doesn't really, there's one thing that's important: can you do your job, right? That's it. All this other stuff, sleep, satisfaction with treatment, it's all secondary. There's surrogate outcome measures. The military cares about, can you do your job? If you're young and you're 20 years old and you're a Marine, can you fight? Because if you can't fight, you shouldn't be in the Marines. The two next lowest were psych injuries, which was about 9%, and back pain, which was 13%. So if you were evacuated with back pain, you were very unlikely to return to your unit. And because there's a lot of parallels between back pain and psychiatric morbidity. So if you look at, so people get back pain in life, right? Almost everyone is going to get back pain, but who ends up with chronic back pain and goes on disability and is not able to work? And so if you look at the risk factors for this, there's a strong consensus. It doesn't have to do with, the severity of degenerative disc disease on MRI, or, how hypertrophied your cassette joints are. Psychosocial factors are the biggest factors. So people who are depressed, people who cope poorly, people who catastrophize, people who don't like their jobs. So there's very strong parallels. And there's a lot of intersection between those, overlap between those signature injuries. So people with PTSD are much more likely to have chronic pain, and chronic pain tends to be associated with traumatic brain injury. They get headaches, they get neck pain, they even get back pain. So there's overlap between all of them. So they're all related. Can't look at one without looking at the others. So the model that they started to use for combat stress is you can't separate them from their unit. So if they leave theater, they don't go back. Injections are not always practical, right? Because there's not pain people at every single military treatment facility, and because most medications used to treat pain can cause central nervous system depression, like gabapentin. So the military looks very, strongly on a lot of alternative treatments. So the things for pain, I think that I had brought this up before. I think everybody, patients, they're looking for a quick fix. But the effect size and the duration of all the treatments that we offer, the effect size is not that great, and the duration is limited, even surgery. And so the important things that everyone agrees, work, I said, like things like exercise. If you're deconditioned, start doing rehabilitation, stop smoking, lose weight. A lot of lifestyle changes. They're harder than they require. An active patient participation. And the other thing is, as a specialty for us, for our voice to be heard, I think a lot of the organizations need to start working with each other.